My name is Triana Montoya, and I did my practicum at Good Samaritan Society in Liberal, Kansas. The agenda is as follows: introduction, organization overview, project components, and comprehensive summary. About Good Samaritan Society. This facility is dedicated to providing post-acute rehabilitation, therapy, and skilled nursing to residents. The organization is part of a larger Good Samaritan Society, which focuses on compassionate care and high-quality services for older adults. Their mission is to care, to comfort, and to cure, and their vision is to be the premier rural health system in the United States. Their core values include service, to providing compassionate care every day, courage, persevering through challenges and taking action, humility, respecting others and continuous learning, stewardship, safeguarding resources responsibly, and family, honoring commitment to residents and staff. The services provided include skilled nursing care, providing 24/7 medical support for residents, rehabilitation therapy, which can be inpatient and outpatient speech, physical, and/or occupational therapy, respite care, which is short-term care options for families, and long-term care, comprehensive support for seniors needing ongoing assistance. Importance of emergency preparedness in healthcare. Emergency preparedness is critical in a nursing home setting to ensure that resident safety and regulatory compliance. Emergency planning helps protect residents and the staff. It helps meet regulatory standards. It improves crisis management, and it enhances communication between staff members and the residents. My role as an intern. I observe the administrator and I also work closely with key departments. These included the social services manager, the health information manager, the minimum data set coordinator, the director of nursing, the infection prevention nurse, the resident activities director, the dietary director, and the maintenance and environmental services director. The administrator oversees the entire facility. She ensures compliance with regulations and maintaining high standards of care throughout the facility. The social services manager, she addresses the social and the emotional needs of residents. She provides support and resources to enhance their quality of life. The HIM manager, she's responsible for managing health information systems, safeguarding patient data, and ensuring accuracy and confidentiality. The MDS coordinator, she handles the minimum data set assessments, and these are essential for evaluating resident care and ensuring appropriate reimbursement. The director of nursing in particular, she also plays a pivotal role in coordinating patient care and ensuring that all nursing procedures are followed to the highest standards. Uh, she not only oversaw the nursing staff, but she also collaborated with other departments to maintain a holistic approach to resident care. The infection prevention team, they're just instrumental in safeguarding the health of the residents, particularly through rigorous protocols and constant vigilance. I know we had an outbreak of COVID, and the infection prevention team was right on top of that right away to make sure more residents didn't get COVID, and also the rest of the staff didn't get COVID. The resident activities director, she also stood out to me. She organizes a variety of engaging programs that enriches their daily lives of the residents, and she just she has a community spirit. So she organizes many activities for them, such as going to the casino, playing bingo, just to name a few, painting. Just she has a variety of activities for them to do. The dietary director, she plays a crucial role in maintaining the nutritional health of residents. She crafts the meal plans that cater to their diverse dietary needs and preferences, as each resident requires a different, what would you call it, a different diet. I also had the opportunity to observe the Maintenance and Environmental Services Director. He ensured that the facility remained in excellent condition and that any issues were promptly addressed. Each department plays a crucial role in ensuring the smooth operation and the delivery of quality care to residents on the daily. Project components. An emergency plan book. I was tasked with developing and updating the emergency plan book. This project aimed to develop and update the emergency plan binder that they had in place at Good Samaritan Society. The proposal was driven by the need to ensure that the facility is well prepared to handle emergencies efficiently and effectively. The updated emergency plan binder would serve as a vital resource for staff in providing clear guidelines and procedures to follow during various types of emergencies. It would enhance the facility's emergency preparedness, their response capabilities, and also to ensure safety and well-being of the residents. The project required collaborations of different stakeholders. These included the administrator, the department managers, and also key personnel. Project schedule. The first step was the initial research and assessment of the current emergency procedures they had in place. The second step was identifying gaps and areas that we could improve on. The third one was the coordination with different departments to gather input and feedback in regards to the procedures they had in place. The fourth one was drafting and reviewing the emergency plan book for each specific emergency. The last one was the actual distribution and the training for the staff on the updated emergency plan. Key sections of the binder. A recall list and resources, which is a phone tree to start the calling process, and resources available in our community. For example, who will provide the water, who will provide food, who will provide propane if we run out, and different resources within our community. The second section is the medical emergency response for outbreaks and for pandemics, and also for elopements. The third one is the disaster preparedness, and this is for any natural disasters such as tornadoes, a flood, a blizzard, snow or ice, an earthquake, severe thunderstorms, and power outages. The fourth one is transportation and evacuation section, which in detail it explains who would we call for transportation in order to evacuate all the residents. And then the fifth section is the fire plan and floor plan, and it shows exactly what to do in case of a fire and it has the floor plans. Section 6 is for the bomb threat and armed intruder, how to proceed in case we're in that situation. Number 7, drills, documenting all the drills that take place. For example, for an armed intruder, a fire drill, an earthquake drill, a tornado drill, just documenting the different drills that are done. The comprehensive summary, the final outcome and deliverables. A comprehensive emergency plan binder was delivered. It was distributed to all the relevant departments and the staff members, and it improved readiness among staff, and it's a long-term benefit for resident safety and facility operations. Thank you. Triana Montoya. And my email is also included in case you need it.